about WLBB, Carrollton, News Talk 1330, FM 106.3.
And welcome to Community Voice. I am your host, Josh Engel, joined today with Miss Jamie Brown. She is the licensed associate professional counselor at the Haralson Behavioral Health Service. Good morning, Jamie. How are you?
I'm great. How about you?
I'm very, very, very well. Thank you.
Happy Friday.
Happy Friday.
Yay,
TGIF.
we made it.
We made it. And it's going to be a great show.
Yes.
Friday shows are always amazing. Jamie, why don't we open up by telling us a little bit about you,
Okay.
about yourself, what brought you to the Haralson County Behavioral Health Service.
Sure. So I am a licensed associate professional counselor. That's LAPC. I work at Haralson Behavioral Health. I've been there about 3 years. Career change late in life. I just kind of led in that direction to help people. The clinic I work at serves all of Haralson County. We do a little bit of everything. We accept people who have insurance, people who don't have insurance, and I really felt a couple years ago that God was kind of leading me in that direction to help people. I had gone through a lot of things in my life, and lessons learned, experiences make you a better person, and I felt like I would be able to help people through those experiences. So I'm pretty excited to be where I am.
Excellent, excellent. Well, there have been some exciting changes at the Haralson Behavioral Health Service, and you were kind of breaking them down a little bit prior to the show.
Sure.
If you would, sort of let folks know the positive changes that have happened regarding open access.
Okay.
And maybe give them a little bit of history of how things
Sure.
have been.
So we are open Monday through Friday. We're open till 6 Monday through Thursday. We get out at 4 on Fridays. Thank goodness. We have traditionally taken new clients every Tuesday and Thursday, and we start opening the doors at 7:30. Well, because it's a first-come, first-served basis, we have people that stand outside our door at 6 o'clock in the morning because they really want to get services. They want to be the first ones seen. At times, we can't see everybody because there's a ton of people and there's a couple of therapists, and we just cannot accommodate everybody who comes in on Tuesday and Thursday. So we, as an organization, began to take a look at how can we better serve people? How can we make this process more inviting, easier for our clients? So we decided that we're going to do our open access on Monday through Thursday, 8 o'clock to 2 o'clock. So no more having to come in at 6 o'clock in the morning and wait for us to open the doors at 7:30 and sit for hours only to know that you might not be seen that day because we're already full. This is going to open up an opportunity for a lot of people to come in at a time that better fits their schedule. So we're excited about that. And we know that this is going to help us bring in some more clients. So again, we're going to do that starting December 1st. So give us a few more days. We're not ready to roll that out just yet, but December 1st is going to be our start date for that. And basically, people come in. You need to bring an ID, Social Security card. If you have insurance, bring that. If you don't, it's okay. If you live in Haralson County, let me just emphasize that. We see residents in Polk County and Carroll if they have insurance. But Haralson County residents are the only ones we see without insurance. So you come in, we give you some paperwork to fill out. You go through an intake process. And basically, it's taking a look at where have you been, where you are, and where do you want to go? It's a kind of lengthy process. I tell people to be patient. I do about 13 documents with every new person. So it's a lot of me typing, asking questions, and you answering. And it is cumbersome sometimes because I want to stop and counsel people, but I can't because I'm on a fact-finding mission. That first visit for us is really getting to know you because the more we know about our clients initially, the better we can serve them. So the first visit is finding out a little bit about people's past, where are they at right now, how we can best help them. We do a treatment plan so that everyone who works there that works with that person can refer to the treatment plan and find out, what are they looking to do? How can we best serve them? So we're pretty thorough. We really are.
It sounds like it. And, a very thorough emotional, spiritual, psychological diagnostic to sort of know where to go from.
Sure.
It makes me feel great knowing that you have such a thorough process in play, that there is such a, joking here, is such a thorough process, to discover the best treatment for the individual.
Yeah.
And also this really puts in perspective just how many folks are out there needing help. Hearing that folks are lining up at 6 in the morning or earlier to just try and get in and see you guys, that's a testament to how important your work is.
I think a lot of things have changed over the years. Mental health used to have this giant stigma, that people who had mental health issues, they were crazy, they couldn't work, they couldn't manage their household, they couldn't raise a family. And social media, TV, celebrities, for what they're worth, have come out over the last few years and talked about battles with their own mental health. I mean, there are people that run Fortune 500 companies that make millions of dollars every year, and they have mental health issues. So the face of mental health has changed over the last few years, and a lot of people are starting to realize that because you have a mental health concern, maybe you have some depression or some anxiety, you're not crazy. You're just, life takes us down different roads, and sometimes we need a little assistance, whether it be through taking a medication or some counseling. So yeah, I think that has really opened up the doors for us, and it is amazing to see there's a lot of people that need services. And also, and I want to mention this, we do a substance abuse program. It's a very intensive outpatient, so it's not inpatient, it's outpatient. We run that program a couple days a week, and it really helps people look at their addiction. How did they get into their addiction? Where are they in wanting to stop their addiction? And how can we help them? So we do have a lot of people who come in that sometimes their situations are generational. A lot of generational mental health. Then there are other people who are college graduates, and maybe they were in between jobs and they stayed at home for a couple months and they really got depressed. And they wake up one day and they're like, wow, here I'm sitting on a 4-year degree and I'm depressed and I haven't worked in 6 months, and what do I do? So they come in, they talk. Do they need meds? If they do, then we give them something to maybe boost their spirits, kind of get them motivated again. And we do some counseling to go back and try to find, how did you end up here? Let's go back and look at how you got here and how we can take you where you want to be.
And I mean, honestly, and I try not to say too much on the show, but, I had a college degree, and pretty much I think it's also a Southern thing. I know it's all over the country, all over the world.
Sure.
If it's not a direct stigma regarding mental health, it is just sort of a lack of belief. It's like, my parents were just like, that's not a thing.
Sure.
That's something that lazy people come up with. That's something that that affects other people, And I've always felt like I was a pretty cool, calm, and collected dude, and I had a college degree, and I've always been pretty successful in terms of jobs and meeting people and making friends. But it was just a few years ago that it sort of finally clicked. I was like, I think that I have some pretty bad anxiety that I just kept burying,
Sure.
And I'm mentioning this because I feel like there may be listeners in a similar situation. I went and did something about it, and I was introduced some amazing medication, and I didn't realize just how big of a problem it was.
Sure.
Prior to talking to somebody. I didn't realize that pretty much every day I'd be having a conversation with somebody and feel like I was having a heart attack just from anxiety. And it wasn't even a thing I thought was possible because of that stigma, especially in the South. It's not something that you have.
Sure.
So I hope that people that are listening, and I promise I'll stop here in a second, but I think that it is important that folks are listening, that it's an illness or it's a problem, just like any, you're not thought of as weak if you have a problem with your spleen,
Sure.
or your liver or something. It's an ailment that you need taken care of. The same applies to mental health.
It does.
And I do believe that in the field that you're working in, where there's clearly such a huge need, these changes seem like they're going to be super positive for your community. We're going to be back here in just a second. We're going to talk more. We'll touch back on the stigma of mental health issues. I'd like to talk a bit more about the substance abuse program that you guys are working on, and your skills building program, right after a word from our sponsors.
At Oak Mountain Academy, our daily schedule includes convocation, prayer, and the Pledge of Allegiance. By doing so, we build a family-like community where all students grow and flourish and personal faith is encouraged. Through community service and a historical approach to biblical study, our students are taught the value of the warrior way, honesty, respect, and responsibility. Oak Mountain Academy. We are a family creating legacies. To learn more, visit oakmountain.us.
At Tanner, we're advancing health throughout West Georgia and East Alabama, because we know that exceptional care isn't based on how many patients we serve, but how well we serve them. That's why we're focused on quality, delivering the best possible care for our patients. It's why we're expanding our clinical services and building new facilities to serve our growing community. And it's why we're looking beyond our hospitals and medical practices to develop sustainable wellness and preventive health programs in our region. What makes a hospital great has changed. It's not how many beds we have. It's how well we care for the neighbors who need them. Delivering the right care to every patient, every time, is how Tanner is advancing health with medicine beyond measure. Learn more at tanner.org or find a physician on our medical staff by calling 770-214-CARE.
And we're back to Community Voice. I'm your host, Josh Engel, joined today with Jamie Brown. She's the licensed associate professional counselor at Haralson Behavioral Health Service. We have been talking about the changes to their open access. In fact, why don't we just do a little recap?
Okay.
Tell folks about the changes regarding open access at the center.
Sure. So we previously did open access, and that's a fancy term for taking in new clients, a first come, first served basis. We did that on Tuesdays and Thursdays starting at 7:30. We would have people lining up outside, sometimes at 6 o'clock in the morning. I mean, just camping out, no matter the weather, just hanging out waiting for us. And we couldn't see everybody. And a lot of people were very discouraged by that. They were having to get someone to bring them in, and then they couldn't get seen. And so they kind of had to walk away just not feeling real good about, being able to get services. So we as an agency thought about how can we make this easier for clients, make it more inviting. So starting December 1st, we are going to do open access Monday through Thursday from 8 o'clock to 2 o'clock. And we're really hopeful that's going to give people an opportunity to be able to get in for services, not have to line up at 6 in the morning, not have to ask people for, a ride so early in the morning, be able to come in at a time that's easier for them. I do want to remind people you're probably going to have to wait because we're going to work you in. And what happens is there'll be a therapist who maybe has a cancellation and someone comes in and they go see her. But it's not going to be as far as it was before, waiting for hours. Sitting in the lobby waiting for hours, and then maybe someone says, oh, by the way, we are full, we really can't see you today. So we're excited about that. And we think it's going to help the community be able to get in to see us quicker and more people to come in.
Making services as available as possible.
Absolutely.
Thank you guys for doing that. And during the break, we were touching back on the stigma of mental health issues, and you started telling me a pretty compelling story. And if you would be willing, I'd like you to go back and maybe share that with our listeners.
Sure. And I haven't told this story to maybe two people, a counselor and a friend. So you guys are going to be some of the first to hear this. But I have worked in mental health for several years now, and I feel like I've counseled people my entire life. And when my clients would come in and talk about depression, and they would tell me that they had a hard time getting out of bed in the morning. They had a hard time fixing their hair, putting their makeup on, or just getting up and getting going. And I would sit across the table from them and think, okay, maybe I understand, but I really don't, because I've been sad during my life and I've gone through some tragic things, but I never really felt like I couldn't kind of go. I never really understood that I just can't do it. Well, back in September, my grandmother passed away, and I had been a caregiver for her for many years. We got to spend lots of great time together, but I was kind of one-on-one with her, and she passed away, and my father had some health issues that came up about that same time. My sister was going through some things, and I realized during that month, from September into October, I was going through the motions. And probably what really brought it to light was my mom calls one day, and she and I talk every day, and she called and we were talking, and she said, Jamie, you're just so negative. And it was like, I just paused for a minute, and I said, what are you talking about? You're negative. You're just so negative now. And I hung up the phone with her that day, and I looked in the mirror at my house, and I said, what's happened? And I realized that I was understanding what depression was for the first time in my life, because I was going to work and put my hair up in a ponytail. I might put my makeup on when I got to work. I might match my clothes up. I wasn't putting my jewelry together. I just wasn't myself. I was doing my job, and I was trying to help other people, but I really needed to help myself.
It's like you're on autopilot. You're not running at your full capacity.
I wasn't at all. So at that point, I reached out to a counselor friend. I went back to counseling. So the counselor's going to counseling. And I said, hey, I got to snap out of this. But during that process, I began to realize this is what these clients are talking about. Because I was waking up and sleeping late and, getting ready, but not really getting ready. Does that make sense? And
Sure,
just
yeah.
going into work. And I thought, I understand what they mean about it's hard to get out of bed. Because I had to talk to myself to get out of bed some mornings. I mean, I really did. I laid there and said, okay, Jamie, you got to get up. You have people that need you today. So during that process, I realized about depression, how it affects people, and how it affects working professionals, just because sometimes life throws these curveballs, and you might catch one, but if you get a couple curveballs, it kind of puts you into this disarray almost. So when my mom told me that, took a look in the mirror, went to see a counselor friend. So the next week at work on Monday, I said, you know what? Monday's going to be a new day. I'm going to get up. I'm going to fix my hair. I'm going to put on my makeup. I'm going to match my outfit. I'm going to put my jewelry on, and I'm going to try this. So I walk into work. Funny thing, I get to work. First person I see, Nurse Rhonda. Jamie, you look great today. Going through the day, another coworker. Man, you're looking good today. So I'm getting some confidence, huh? So I decided when I got home that night, the rest of the week, I would go back to me. I just go back to what I knew, back to the basics. I would get myself ready every day. I would just see how it made me feel. The entire week I did that. And it was amazing to see my coworkers. They recognized that, hey, she's coming out of it. They didn't really know what I was coming out of, but they knew something was different.
Yep.
So it really gave me a new appreciation from my clients. And I understand now when they say, I can't do it, Jamie, I just don't feel like it, because I didn't. So it's been a really cool experience. I thank the Lord for letting me go through that, because I feel like it's helped me as a counselor. I have a better insight.
Sure. Strengthens your empathy. And here,
Yes.
give me bones for telling that story. I'm very proud of you.
Yeah.
That was great. Thank you for
Thank
telling
you.
that story. That means a lot to me, and it means a lot to listeners, because people they refuse to accept, whether it be ignorance, whether it be being uninformed. People don't realize the brain is like a very complex computer. And there's always a line of folks with issues with their computer because they downloaded a virus or something, or there was a lightning struck something and there was a power surge. People or a piece of software is outdated. It's like it's the same thing. You said the life throws you curveballs. Mm-hmm. Sometimes things happen and it can derail that computer, and you need to be rebooted, or you need some attention. You need some work on it. And I think that the sooner people accept that and they understand that it's okay to have problems.
Absolutely.
It's okay. It's all right. You're not weak. You're not less. People go through way more than you can possibly imagine. But that doesn't mean that what you're going through isn't important, or that it doesn't need help. So thank you for sharing that story.
You're
I
welcome.
think that really helps listeners. And regarding the stigma of mental health, I think that sometimes it helps when folks realize that their families are going to the Haralson Behavioral Health Service or something similar. It's
Sure.
like, if you're having issues, don't be afraid to talk about it.
And you mentioned families, and I do want to touch on that for a minute. A lot of families sometimes don't understand, because my clients come in, they say, my family thinks I'm crazy, they don't want to talk about it. So I will say to the families out there, if you have a person in your family and they have a mental health concern, issue, whatever we want to call it, don't shun them. Don't not talk about it. Educate yourself. Just do a Google search. Talk to someone. Hey, so a family member of mine has bipolar. Well, what is bipolar? Well, look it up. Just because they have bipolar, or they have schizophrenia, or they have depression or anxiety, doesn't mean they're crazy. And you don't have to tiptoe around, well, what do I say to them? How do I communicate with them? No, just find out. They have good days, they have bad days. Find out that, when they're having a manic episode and they're talking 90 to nothing and, they're just kind of out of it. So maybe that day you have a little more patience. You're calmer with them. And I think families really need to focus on, if you have somebody in your family, educate yourself, know what they're going through, have some patience, have a little compassion for them. And if they don't have services somewhere, get them to somebody. There are people that are out there that are struggling through life because they're afraid to go in, they don't know where to go, they're ashamed to go. If they come into a mental health clinic like ours, or just a mental health clinic anywhere, and get services, they can have a healthy quality of life.
And everyone deserves to have a healthy quality of life.
Sure.
We're going to come back and chat a little bit more about events over at the Haralson Behavioral Health Service right after a word from our sponsors.
At Tanner, we're advancing health throughout West Georgia and East Alabama because we know that exceptional care isn't based on how many patients we serve, but how well we serve them. That's why we're focused on quality, delivering the best possible care for our patients. It's why we're expanding our clinical services and building new facilities to serve our growing community. And it's why we're looking beyond our hospitals and medical practices to develop sustainable wellness and preventive health programs in our region. What makes a hospital great has changed. It's not how many beds we have. It's how well we care for the neighbors who need them. Delivering the right care to every patient, every time, is how Tanner is advancing health with medicine beyond measure. Learn more at tanner.org or find a physician on our medical staff by calling 770-214-CARE.
Oak Mountain Academy has offered a challenging college preparatory education for over 50 years. With over 500 graduates, we have maintained a 100% college acceptance rate. Over 90% of our students earn acceptance to their first choice of college or university, and over the past 5 years, our students have earned over $10 million in scholarship offers. Our students are creating a legacy. Come, be a part of our family and create your own legacy today. To learn more, visit us at oakmountain.us.
And we're back to Community Voice. I'm your host, Josh Engel, joined today by Jamie Brown, the licensed associate professional counselor at Haralson Behavioral Health Service. Service or services? Services. Excellent,
Plural.
excellent. So we've been chatting about some pretty important changes that are happening over at the Haralson Behavioral Health Services, including the open access now Monday through Thursday, 8 a.m. to 2 p.m. This is so as to best accommodate as many folks as possible from the community that are needing to get some treatment or that need to talk to somebody. They're trying to make it as available as possible. We've been talking a bit about the stigma of mental health issues, and something we were excited to touch on was the substance abuse outpatient program that you are currently working on. So take it away.
Definitely. Sure. We also provide substance abuse counseling. We do a very intensive outpatient program, 3 days a week, Monday, Wednesday, Friday. Start around 9 o'clock, finish around 1. It's a very moving type program as far as really looking at people as what caused their substance abuse, what is the root of the problem, where are they in their recovery, where do they want to be. We provide classes, transportation for folks who do not have transportation. We pick them up, bring them in. We do a co-occurring group on Tuesday. So we have the substance abuse, that's Monday, Wednesday, and Friday, and that's for people who just have substance abuse. But a lot of folks have substance abuse concerns and mental health. So just on Tuesdays, we do a special group, co-occurring, name-fitting, 2 different diagnoses. You have some mental health and you have substance abuse. We do that group on Tuesdays as well, and it runs from around 9 o'clock until 1. And the person who actually does that program, I want to brag on her for a little bit. She is a recovering substance abuse abuser. She's been in recovery for about 6 years. So I think that's important for people to know, too, that you'll be learning from someone and recovering with someone who's going through recovery themselves. And it gives it a whole different spin on things, because it's one thing for me to tell you about what school taught me or read something out of a book, but when I can tell you from personal experience, I've been through something, and she can do that. And I think the program is really going to expand with her there, and we're excited about it. She does have a lot of experience in what she's doing, and as far as her own recovery, knowing how to, maintain, to stay in that recovery mode all the time, because it's very hard. And the holidays too, and I'll touch on that for a minute. Holidays are a really tough time for people who have substance abuse issues because they're exposed more to people who are drinking, or there's some friends who've come back into town and they're doing a little bit of this and a little bit of that, and it's very challenging to maintain that sobriety during holidays. But we want to talk to people about the fact that, just hold on and hang on. And we're noticing, especially in the county we live in, a lot of young people are coming in. I mean, drugs these days, they run the gamut. It's not just the people who are in one social class anymore. It's across the board. So we want to really have parents to kind of be on the lookout, things you see in your teens, your young adults, things that are a little bit different. A lot of people start out with something like cigarettes. And parents, oh, well, they're just smoking cigarettes. Well, sometimes cigarettes lead into marijuana. Marijuana leads into meth. And we're seeing a lot of people, too, that are doing heroin. That's had to come back. So we want people to really be cautious and be observant about your friends and your family. If you think someone has a problem with drugs, talk to them. Just say, hey, let's talk about this. What's going on? Because lots of times if families and friends can get somebody quickly before they dive headfirst into the addiction, their chances of being able to recover are a lot better.
Sure. And just from a dear family member of mine that, who would have thought? No one would have ever expected her to end up even coming in contact with methamphetamines,
Sure.
let alone becoming an addict. And her life spiraling out of control. she's a pastor's daughter. Who would have ever seen that coming? And she told us later that it was like the longer it went, the harder it was to say something.
Sure.
Because it just got worse and worse and worse. And it's okay to talk about it. It's okay to say, look, man, I made a mistake. Mm-hmm. And I feel like I'm not in control anymore. And I need some help.
Sure.
You're not weak. You're not weak for needing that. So I think it's fantastic that you guys have this program in place. So, and you said that you guys provide transportation to folks.
We do. A lot of people don't realize that, but we do. Now, if you have insurance, I want to say Medicaid, Medicare, one of those, they provide transportation. But if you don't have insurance, then yes, we pick you up from your home, we take you to your class, we bring you into counseling, we take you back. So that's really an added benefit. Not a lot of places do that, so we're very happy that we can provide that service. And that helps a lot of people because transportation is a problem. It is.
It genuinely is. Now, tell us a bit more about the skills building programs that you guys have in place.
Sure. So whenever you said Haralson Behavioral Services plural, we do a ton of stuff. And a lot of people don't realize, they look at us as we're a mental health clinic. Okay, we are. But under that umbrella is a ton of things. We talked about substance abuse. We do classes. We do counseling. We do skills building. We do case management. We even provide groups. We do a trauma group, and I'll touch on that in a little bit. We'll circle back to that. But you mentioned skills building. So we do something called case management and skills building to help people. Help people in the way of, let's say someone's looking for a job. So we help connect them to a job. Maybe they need to go to a food pantry. Maybe they need to go to a clothing closet. Maybe they need to apply for food stamps, or they need to go to Social Security. We actually connect them with someone who, again, will pick them up from their home, take them to Social Security, take them to a food pantry, take them grocery shopping sometimes. So we do a lot of case management where we're connecting people to resources that they need in our community. Skills building. So let's say that someone is, they're getting disability for the first time. So they get their check, and at the end of the month, they say, you know what, I have no money left over. I don't know how to manage my money. We teach them. It's like soft skills. We teach them how to manage their money. Communication. Some people have a hard time communicating with others. We teach them how to communicate. Maybe organizational skills. Let's just say that, you have your home and you've become somewhat of a hoarder and it's become overwhelming. So we go into your home, we teach you, show you, educate you. Here's how you do this. Socialization skills. A lot of people just don't really know how to socialize. Or they've gotten out of their social circle for a while and they're trying to get back in and get acquainted with people. We teach them how to be sociable. We identify places where you can go, how you can meet other people.
Well, excellent.
Yeah.
That's fantastic. And and I think it's important, again, just to remember the program started with this, and I want to make sure if you're just tuning in that you realize open access is now Monday through Thursday, 8 a.m. to 2 p.m.
Starting December 1st.
Starting December 1st. Not yet. Give them some time.
Give us a little time.
When December 1st rolls around, these new changes are going to be rolled out. And you mentioned something about the distance away from.
Yes. I want to thank one of my coworkers, Miss Julie Newsom. She sent me a text and wanted to remind me, and I'm glad she did, that we are now serving people in a 50-mile radius. So my thought process was that we were just doing no insurance in Haralson County, but no. So we're going 50 miles out. So now if you live within 50 miles of Haralson County and you don't have insurance, we'll still take you.
That's excellent.
Which is great news.
We only have a little bit of time left,
Okay.
and I wanted to ask you, if people want more information, where can they get it?
Sure.
Websites, Facebook?
We have a Facebook. You can call us. Our number is 770-537-2367. You can look us up on Facebook, Haralson Behavioral Health Services. We are at 1449 Temple Road in Bremen, and that's right on the outskirts of Bremen. It used to be Cashtown, then they revamped the road, and a lot of people that have been there all their lives say it's old Cashtown, but the address really is 1449 Temple Road, probably 2 minutes from downtown Bremen. Very easy to find. And we are there Monday through Thursday.
Excellent.
Yeah, and Friday till 4.
Well, Jamie, thank you so much for coming on, and look forward to having you again soon.
Sure, thank you.
Thank you, ma'am.